When the patient arrives at the Niagara Health Center, they are admitted to one of the facility's 8 beds. After obtaining a pertinent history, the nurse reports that information to the physician, who then goes to the patient's bedside, completes the assessment, and finalizes the patient's course of treatment for that visit. Patients not only meet with their physician for the initial assessment, but also before and after each procedure. Before the patient signs their informed consent, the physician and the nurse once again explain the procedure. The patient is then transferred on a surgical cart into one of the facility's 2 surgical suites. Once the patient is properly positioned and a fluoroscopy image is obtained, the physician and nurse perform an operative timeout before proceeding according to Joint Commission requirements. This timeout includes identifying the correct patient by the patient stating their name and date of birth and seeing that it matches the chart, identifying the correct side and site of procedure and correlating it with the marked site, agreement on the procedure to be done, correlating with the informed consent, and assuring that the patient is correctly positioned. Once this timeout is completed, the procedure is performed. Conscious sedation is administered if necessary, using appropriate monitoring. When the procedure is completed, the patient is transferred back to the admitting area where they are monitored until ready for discharge. Prior to leaving the facility, they are assessed, a subsequent visit is scheduled if necessary, and discharge instructions are reviewed. Patients are followed up by phone within 24 hours after the procedure, and their response to treatment is documented and given to the physician.